Welcome to Unclenched podcast with myself, Dr. Priya, and the magnificent Dr. Alex. This podcast, we are going to talk about signs and symptoms of TMJ, TMD. I will discuss one patient in detail, and Dr. Alex will also discuss one patient in detail. You may find a resemblance to yourself. You may find that you're experiencing these signs or symptoms. And so sometimes it's nice to hear about people that have gone through the same thing. At the end of the podcast, we will answer a couple questions from you guys, our wonderful listeners. So I'll be talking about the symptoms, which are things that a TMJ patient would feel.
And then I'm going to be talking about the signs. These are things that you may see, your dentist may see, even your physician or ENT may see. And if you're listening to us on some kind of streaming like Spotify or what have you, you may want to switch to YouTube so you can see these signs because we're going to be putting pictures up.
Yeah, that's a good idea. And before we get started, Dr. Alex, how was your month? Did you do anything fun? Let's start out with a patient also that stuck out to us this month or week. So yeah, tell me about yourself and your patient.
Sure. So fun-wise, January, starting the diet, starting the drinking water, all that kind of stuff. So I don't know how fun that is, but, outlining my goals for the year and what I have personally and professionally planned. So I always like to do that. That's always a little bit of fun for me.
Good.
And, didn't get to see my girls yet because they're back in their domains and I'm missing on them. But thank God for FaceTime and for the phone because we do live on that. But speaking of the patient, I do have a patient that stuck out to me. So I'm in Pittsburgh and this patient of mine, CJ, is in Cleveland and I love CJ. So CJ comes to me and Cleveland, she's up on the lake. So they got a lot of snow and sometimes it's hard for her to get in and what have you. But she made the jaunt in and she was experiencing a lot of signs and symptoms. She had headaches, she had limited opening, ringing in the ears. You're going to go through a lot of these things. So she had probably about 20 of the things that Priya is going to go over, but she sticks out to me because one, we got her feeling good and she's great. But one thing we did on her too was a tongue release because she was tongue tied. So when she came in post-operatively for me to see her and she's like, I can't believe it. And I said, what? And she says, everything relaxed from my head to my toes. My foot, my plantar fasciitis doesn't bother me anymore. My hips are feeling good. And CJ is all about figuring out the why. Kind of like you and I, Priya. We want to figure out like why is it happening, right? So she's like a cold plunger. She's a red sauna girl. The funny thing is one day, this is a little off topic, but she brought me a cooch ball for your cooch.
I thought that's what you said.
And I was like, that's not what she said. Right? So it's, how we're all connected and pelvic floor.
Yeah,
so she brought me this cooch ball for me to see. And I ordered one because she told me about it before. I'm like, what the hell is that? So you sit on this cooch ball and it helps your pelvic floor. So we're talking about literally from the mouth to, down low. So, so that's why CJ stuck out to me. And she brought me protein. So she's all about figuring out how to keep her body, in top working order, proper sleep, lip tape. The woman does it all. I tell her, I say, you need to start a podcast of your own because she's just a wealth of knowledge. And so CJ's who stuck out to me and she's feeling well after the tongue release. And
oh my gosh,
she's wearing a removable orthotic and things are going well.
Good.
How about you?
She sounds
How
like
was
a fun
your month?
She sounds like a fun patient.
She is fun.
My month was good. What did we do? We took the kids to the snow and my little guy had his first skiing lesson and my daughter had her second one. And so that's exciting. My husband's a really good skier and I have no experience with any of that. But the kids, we want to make sure that they learn how to ski too. So that was a really fun trip up.
Yeah.
We went with some friends. We stayed at a beautiful condo and we cooked dinners and hung out with our friends and the kids played in the snow. We went sledding one day. So that was a really nice little break. And it's only
Yeah.
about an hour and a half away. So we went to Mount
So wait
Hood,
a
which
minute, you don't ski?
I didn't grow up doing
No.
any of that.
Yeah, so it's hard now because now you're a little bit more
I'm
intimidated
afraid to
by it.
break my
Yeah,
hands.
I know, right? They
Yeah,
need your hands.
I need
Everybody
my
needs
hands.
your hands.
Yeah, so I
Yeah.
mean, I might take a lesson. I've been sort of thinking about it, but we'll see. We'll see where that goes. And for a patient that stuck out to me, I love this patient. He is so funny. His name is Riz. And Riz and I met before I bought this TMJ practice. I was practicing general dentistry at another local practice, and I was being mentored by my TMJ mentor. So I had kind of two things going on. And at my regular general practice, I met Riz and I saw him just for a cleaning and exam. And we were talking, and I noticed there was a lot of popping in his jaw. And I could just tell that his right joint was unstable. You
Sure,
know, after you felt a lot of joints, like
sure.
when they're kind of hypermobile and unstable and things are popping in and out just a lot, and I thought, "Oh my gosh," and so I asked him about his jaw. He's like, "Oh, yeah, it hurts all the time. It's popping, clicking, crackling, making all these noises," and I noticed he kept rolling his shoulder and his neck and just he could never get comfortable, and he's a young guy. I mean, like, he's in his early 20s now. So that was, like, 4 years ago when I met him. So I told him then, I said, "Come to my TMJ practice. I think we can help you." And I never saw him until last year. And then he came to this my practice and we've moved locations and all that. And as soon as I saw him, he's like, "I know you." And I was like, "I know you." Because my practice, the TMJ practice name has changed. It's changed locations.
Sure.
And then I remembered because it's a unique name, Riz. And he's just such a like fun character. Like he's really talkative. He's really nice. He's tall. He's just, you gotta love Riz. So I thought, okay, well, it's good to see you again. But unfortunately, what had happened is that he had completely locked closed. So he could barely open his mouth. He was in a ton of pain. He had gone to the ER over the weekend and they couldn't get him unlocked. And he was just
Wow.
nervous and upset. And anyways, so that was last year, and now, I saw him this week, and he's completely unlocked. He no longer has, clicking or popping. He doesn't have pain in his jaw. He doesn't have ear pain. He doesn't have ear
Ugh,
pressure, neck pain, or shoulder pain, but he still rolls his shoulder a lot. So I've encouraged him to work with a body worker that can help with that. But, I'm glad he finally took treatment. I got to see him again, even though it had
oh,
been many years, and so that's always kind of a fun thing. And whenever I mean, he's just fun. Like, he walks into the office and the atmosphere just sort of it lights
lifts.
up, and so
Yeah,
it's always good to see him, and he's doing better, so that's good
yeah,
too. But yes.
yeah. Oh, that's great. That's so
Yeah.
great.
Yeah, yeah, it's fun to see him. So yeah, let's just dive right in.
Sure.
I can list off the symptoms, and then if you'd like, you can list off the signs. What do you think of that?
Okay. Okay, so, yeah, I think that's great. You go. Have at it.
I'm
Mom
sorry,
boss. I
Alex.
just saw your cup. Mom
Mom
boss.
boss, do you like that? I am losing my voice, Alex. I talk too much. So, Alan, I'm sorry you're gonna have to cut all this out.
No,
Um,
no, don't cut it out. Just leave it in there. Go with it.
roll with it. Okay, so lists of the signs or the so I'm gonna talk about the symptoms that we want to talk about. The number one reason people come to see me is headaches, and then jaw pain, neck pain, ear pain, jaw joint noises like clicking, popping, episodes of the jaw actually catching or locking, stuffy ears, dizziness, ringing ears, tooth pain, numbness and tingling in the face or fingertips, gum pain, pain around the eyebrow or around the eye or behind the eye. Those are a lot of the things that I hear. And it's quite the variety. And for that reason, TMD is often called the great imposter disease. It can be super hard to figure out what's going on. And with that, I even had a patient once where her one symptom, this was it, was stabbing ice pick ear pain. So she had
Yes.
been to every ENT under the sun, moon, and stars with no real answers until she came to see me. So really, you can have one of these symptoms or any variety of them, and it can still be TMD. So on to you, Dr. Alex. You can go over the signs.
Yes. So with the signs, we're going to show you some pictures, but I before we get there, I just want to talk and ask you a few things about your symptoms.
Sure.
So, headaches. How many times do you hear people say, "Oh, they're hormonal," which some are.
Summer.
But how many of those hormonal headaches go down?
So many.
I was one of those that
Mhm.
had
Oh.
hormonal I thought they were hormonal headaches, but
Mhm.
then when I got myself fixed, I don't have them anymore.
Isn't that amazing?
It's amazing.
Yeah, I see it all the time. All the
So
time.
the headaches that you're referring to, where are they located?
Anywhere and everywhere. So, it can be the temples, it can be the
Mhm,
back of the head, it can be the top of the head, it can be the front, it can be behind the eyes, it can be completely one-sided
mhm,
or
mhm.
both. It
Exactly.
can switch around. It can even be migraines. I know a lot of people differentiate migraines from regular headaches, and I even have patients that have full-blown migraines, and then they'll have their regular headaches, which are like tension headaches. So it can
Sure.
be like a band around the head. I mean, I've really heard it all.
Now have you heard? Because 'cause I've heard this too, like a itching kinda fuzzy scalp.
Yeah,
Have you ever heard that? And they're
yeah,
just like they just wanna kinda itch it,
yeah.
or their hair feels funny. I've
Yes,
had that people tell me that too.
yes, yes.
And when they come to you with all of these symptoms, I'm like they look at you and you're going, "Yeah, yeah," and they're like, "Everybody else thinks I'm crazy."
Yeah. I'm like, "You're not crazy.
Yeah,
I've heard
yeah.
this.
"We
Yeah.
gotcha."
We got you. We can help."
Yeah. Yeah, so those are funny, and then the ears, you said the stuffy ears. They've been to ENTs, they've looked, and they found nothing?
Mhm.
And that's how my patients are too. They've been to ENTs, and if one ENT sometimes they'll go to another to make sure. What about the dizziness? What do people tell you about their dizziness?
So dizziness is an interesting one. I always like to clarify. I say, what does that mean? Is the room spinning or do you
Mhm.
feel off balance? And mostly it's that people feel off balance. It's kind of
Me
rare
too.
that, yeah, that the room is spinning. I've heard that once or twice, but it's mostly off balance. And then I had one patient just yesterday who was saying it's not so much off balance as it is, she just randomly feels like she's going to fall down and then she doesn't.
Ah,
Yeah. So I
interesting.
thought that was kind of interesting, but it's usually the off balance sensation.
Mhm, mhm. How about brain fog?
Oh, yeah.
I
Brain
get
fog's
that a
common.
lot too, like
Yeah,
my thoughts just aren't clear.
yeah.
And, well, your thoughts aren't clear in my eyes, in my opinion, because your muscles you're not aligned right. Your muscles are a little bit probably tight, cutting off the blood flow up into the brain to release all the chemicals and give you some clear thoughts. I mean, that's so common,
It's
and
so common.
people once they say that, "Hey, I'm getting, I'm not as foggy," or
Yeah.
I mean, I'm granted, I'm one that goes to the closet and opens the door, and I'm like, "What did I come here for?" I do get those moments,
Yeah.
but it's a little bit different with the brain fog. Anything else you wanna kinda dive into on
Well,
this
I did wanna just touch on the brain fog. I
Yeah.
did have a patient this week. I made her a nighttime and a daytime orthotic, removable, and her
Mhm.
nighttime one, there's no way she can wear it during the day because it fits on the upper, it has a flange that comes down. It's the ARA, anterior
Okay,
repositioning appliance, or also called the
okay.
Ferrara appliance. So when she lost her daytime one, she had been doing so well that we just thought, "Okay, well, you're doing so well, maybe you don't need it."
Sure.
So we said, "Let's see how it goes." She came in yesterday, she's like, "My brain fog's back, my jaw tension's back, I need that thing. I need the daytime one." So we
See
just
that?
ordered another daytime one for her, but, the brain fog is a real thing, and I think it's because when you're in constant pain or
Right.
tension or
True.
discomfort or however you wanna describe it, your body goes into fight or flight mode, and imagine constantly being in fight or flight mode. Of course, you're gonna have brain fog. All your
Right.
energy is being directed towards, "How do we lessen this pain? How do I feel better?" I was in
Mhm.
fight or flight once. Walked up to a truck. I was getting into the passenger seat or trying to. I opened the door. This guy flew out of the back of the truck right in my face with a knife. He had been in there stealing stuff because we had gone shopping, and I booked it. Like, I was gone. I was not fight. I was flight. I was out of there. But I can't fight. I can't fight. And so I was gone. I don't even remember doing that. All I remember is being like
Wow.
finding myself on like down the street and I was shaking. Imagine
Wow.
always being in fight or flight. Of course you're gonna have
Oh
brain
my
fog.
gosh.
Of course
Right.
you're gonna have brain fog. So, and anyway, the guy got away, nobody got hurt. I don't know if anyone cares about that story, but just so you know.
That's just crazy.
Yeah, yeah.
But another one too that everybody when they're checking off their, health history, a lot of them have anxiety, and I think a lot of that is because of the always fight or flight,
Mhm.
or the pain, and then they're anxious, "What's wrong with me? Why can't anybody help me?"
Yeah.
And a lot of the anxiety and then they get depressed, and they're on the
Yes,
depression medication,
I know.
and a lot of that is just so related to nobody ever being able to give them an answer. Because there are
Yeah.
so many of my patients that have come down off of medications,
Mhm.
and of course, I always have the physician wean them off. I'm
Yes.
like, "This is not my arena.
Yeah.
Whoever prescribed that for you needs to help take you off." But it's amazing too how many people are on so many medications, and it's like no one's knowing what the other's doing because everybody goes to a doctor for something. You go to a doctor for your big toe, and you go to a doctor for your right elbow, and, everybody's always different.
I know.
So nobody knows. So that's one thing too. So the symptoms just like of the anxiety and the pain can also be related to the other symptoms that you've said. They're all intertwined in a
All
fashion.
intertwined. They're all
Yeah.
intertwined, and that's what I love about what we do is because I've established a really great team of other practitioners here, and we all
Mhm.
work together, and I know you have too, so
Yeah.
it's great.
Yeah. I love that. So at some point in time, we're gonna have to have some of those practitioners on too. There's just so darn much to talk
Oh, I
about
know. It's gonna be
and to
never ending.
say. Yeah, yeah. So, let me start with some pictures. So this is where you have to go and switch to YouTube or pick up your phone if you can see us and look at some of the signs. So again, these are some of the things that you can look at, you can see, your dentist will see, and your physicians can see too if they have any knowledge of what goes on in that little black hole, the mouth. So the first thing we're going to look at is called bicuspid drop off. So as you can see, this is a roller coaster of a bite. And the bicuspids are behind. It's like you're doing the little wavy ding. So the bicuspids are the teeth that are the arch right on the side of the arch. They're like the big teeth. I mean, the cuspids. So right behind the cuspids, as Priya, my model, will show you, are the bicuspids, and they are sitting lower. So that's bicuspid drop off. Now think about your jaw and trying to close into that position so the teeth touch normally. And it's kind of like a wonk wonk when you kind of close. So that's bicuspid drop off. The next thing that you can look at and see if you have in your mouth are chipped or worn teeth. This is pretty easy, and a lot of people will know if their teeth are chipped or worn. And you can tell this is a good picture here. And on this patient here, you can see almost through the tooth because they've worn the inside of the tooth. And whenever they come forward in that bite and their teeth are edge to edge, then they keep wearing. So you're coming forward to talk, you're coming forward to chew, to function, and you're wanting to come into that forward position. And then on the tops of those teeth, you can see how they're kind of cupped out and they're worn out and they're just starting to deteriorate. So the other thing on this picture also is by the cuspid on the top, you can see where it's receded. The gum is pulling up, and there's like a little tiny shelf. Sometimes people say they get food caught in that shelf. And that's because of the way the pressure going down the tooth is making the gum tissue erode in that area. The next one, this is a good one. This is lingual tori. So let's show
Ooh.
you what that is. Lingual means it's on the side of your tongue, and the tori are those bony protrusions where, look, the tongue has nowhere now to go. And the bone, you were not born with it. Patients are amazed, like, what do you mean? I thought I always had those. But it grows gradually as the pressures are put down the axis of the tooth. The body responds by laying more bone. So if you're a sleep apnea patient, I would highly recommend getting those tori looked at and possibly removed. Patients of mine that have had them removed are so glad because now their tongue can sit there better. And it's like the garage is too small for the car, being the tongue. The tongue can't fit in there.
Oh, yeah. So, with the tongue, if you get those tori removed, if that's what's recommended by the surgeon, and your tongue can rest in that space, it can also make your airway a little bigger, if your tongue can come a little bit
Absolutely.
more forward. Um,
Right.
so that's one thing, and the second thing that I learned, I think it was from Jameson Spencer. I don't maybe it was him, yeah, but, he says that everyone is either a bone builder or a bone breaker downer, and I loved that, because if you build bone, that is like these tori at the bottom of the mouth here, that is your body's defense mechanism towards all that
Right.
force that you're putting into your teeth from clenching and grinding. It's your body saying, like, how do we support all this? How can we buttress against this, right? And so that's
Mhm.
why these tori form. And then the people that are bone breaker downers, they don't form these tori. What happens is the bone starts to recede and the teeth get loose. So you'd
Right.
much rather be a bone builder than a bone breaker downer, but when you're a bone builder, it also has its own set of problems. And so I think that's all I have to say.
Right. Now, so that's a good point too, because I talk to my patients, and one of the analogies I use is that if you take a pole and you put it in the ground and you hit that pole from the top, it just continues to go in the ground and it stays sturdy. But once you put that clenching and grinding mechanism on there, you would wiggle the pole from the top back and forth. You loosen the earth around that pole and it gets looser. Just like you were saying, the teeth will get loose, and that will happen unless, like you said, your body mechanism is to lay bone down. So the next slide I have here. Now this is lingual toride on the inside. The next slide is this is a maxillary toride. This is on the roof of the mouth. Look at that baby. Where do you think that's going?
Hello. That's a big boy.
Yeah. Yeah. So we tell our patients that your good tongue positioning is at the roof of your mouth, right behind your front teeth. There you go. See, Priya, how beautifully you're like my Vanna White.
The Price is Right girls, you know?
Right, 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 right. Right. And you want your tongue like on the middle between behind your front teeth on bone, and then you also want it to lay up on your palate. But here you've got this bone growing on your palate. And
Do it.
I had a hygienist one time working for me, and we were going through all this stuff, and I was showing her signs. She goes, "Oh, I've got something sagging in my palate." I said, "Well, it's hard to." She goes, "No, no, the roof of my mouth is sagging." I'm like, "It's tori," but
Mhm.
that's what it is.
Mhm.
That's maxillary tori. I thought that was a great picture.
It is a good picture.
Another thing that happens a lot, Priya, is that people will come in and they'll have missing teeth and multiple root canals.
Right.
And so this is an x-ray of missing teeth. And this person has one, two, three, four, five root canals. So you know something's off with the bite because they keep beating the teeth and making them die. Because when you look at her other x-rays, and I know patients are looking at this, but doctors or students might also be looking at this too. And they would see like her fillings are quite small
Yeah.
on all the other teeth.
They're
So
not huge.
why the heck on those couple teeth did she have such large fillings? I mean, you look at the 12-year molars on the lower left and the 6-year molar, there's not even a filling in there. What did
No.
she brush one half of her mouth and
Yeah.
not and brushed the other side and kept it cavity free? So what happened with this patient was teeth broke because of the forces of occlusion, and she needed root canals, or in her case, she went to a doctor and was just looking for the pain. It's this tooth.
I
Well,
know.
they didn't see anything, but they root canaled it. Well, if it's not that tooth and your pain didn't go away, we'll try this one and see if your pain goes away. Well, that pain didn't go away. Okay, let's hop up on top and do this one. And it's like a guessing game.
Uh,
So that I see a lot. I'm sure you see that
I
too.
see that so much, and it breaks my heart, or even extractions, trying to get rid of the pain. And
Right, right,
one
right.
thing I want to point out too is that there are multiple people who, with the forces of clenching and grinding, crack their teeth so significantly that it cracks into the nerve. And then they
Sure.
need a root canal, or it cracks enough that they need a crown. So if you've
Or
had
an
multiple,
extraction.
or extraction, yeah. And
Yeah,
so if you've had multiple teeth crack, that's a pretty good
right,
sign that you're clenching and grinding your teeth. Teeth should not crack at all in our lifetime with normal chewing forces or how we use them to speak. They should
correct.
not crack. And so if you're having a tooth crack every year, you've got to do
Right,
something to protect your teeth. So,
right,
yeah.
right. This next picture I'm gonna show is overclosed. So, when someone's overclosed, their upper teeth almost hide their lower teeth, and in some cases they do. So that mandible cannot come forward. It
Mhm.
is trapped behind the maxilla or the teeth on top. Maxilla is your upper jaw. Your upper jaw is stationary with your skull. So the lower jaw is the movable one, but it's always got to fall back to chew. To swallow, your teeth should come together. So it's always going back in that restrictive mode, and that will cause you pain.
Mhm.
Anything there, Priya?
Oh, I see this all the time. I would say
Yeah.
so many of my patients are overclosed, and that's what's caused their whole problem. So the way I explain it, and I'm sorry to keep hijacking, but I feel like it's
No,
like
no, I want
yeah,
you.
okay. I always say the top teeth and the bottom teeth from the side, if
Yeah,
we're looking from the side, should come together like this. So this
correct.
episode, you guys, if anyone's listening, you really wanna view it because there's a lot of good
Yeah,
visuals. So they should ideally come together like this. And then when they have a bite like what's displayed here, I say, "You come together, not only a little bit like this, but a lot like this." So
yeah,
every time your teeth come together, 2,000 times a day when we swallow, chewing,
sure.
clenching, grinding, what happens is that your upper teeth trap your bottom teeth. Therefore, your whole jaw further back from ideal.
Mhm.
If it's further back, that leads to more clicking, popping. It can cause it to lock, and it makes the muscles very unhappy. And that causes
Uh,
all the pain. So that's how I see this bite all the time, all the time.
yep, yep. The next one is overclosed also, but this is buccal tori. So see how the
Ooh,
tori shelves are up by those molars?
look at those
Hello.
puppies. Yeah.
Yeah.
Wow.
So this patient of mine, great gal, she had her lateral incisors removed
See that. Yeah.
and they closed everything up. So they made everything nice and narrow. And so that's a narrow arch because they took the teeth out on the top. So where her canines are next to her two front teeth, her canines, they moved them in and made everything compress and constrict in. And now her lower teeth, you can see the tilting. That's another sign.
Mm.
Your teeth are tilting in. So she was in horrific pain, a lot
Poor
of pain. So
thing.
what we did, put her in an orthotic, got her comfortable, opened her up, made space, put implants, where they pulled the teeth, put implants back in, gave her a
Awesome.
beautiful broad smile. I'll have to show that one day because that
Yes,
came out
I
really
think
good.
people would really wanna see that, and also with these shelves of the tori on the top, those bony
She'd
shelves.
get feet caught up there.
Oh, I'm sure she did, but, like, what's interesting is the people that have these, they kind of think everybody has these because that's
Right,
their normal, and they're not going around looking in people's mouths, right?
right,
And then when we explain to them, "This is why these formed, you did not have these when you were born, there's no way." Then,
right.
like, they really start connecting all the dots, but that's I
Yeah,
would love to see the end result of that case, so maybe we can do that
yeah.
on another
Maybe we
episode.
could do that one time, but yeah,
Yeah,
so that was really a good case. It took time because ortho takes time, implants take time, all that kind of stuff. The next one is recession. So, recession is when the gums start to pull up away from the teeth. And you can see that behind again that canine or eye tooth on the top there. You can see how the tissue's pulling up. There's a little redness on the tissue. And if you see how that bicuspid and the lower bicuspid touch together, you can see those forces. That force is making that recession on the top when they go into their chewing motion. Because when you chew in a teardrop. So
mhm,
you're constantly banging those cusps. And like you said earlier, you're either a bone layer downer or you're a tissue bone loser. Okay. The next slide I have here to show, these are the most common ones. There are other ones, but there
yeah.
were so many to do. But the next slide is tongue tie.
Oh,
That's a
yes.
big one. So as you can see that tissue right in the middle of the tongue when she lifts her tongue, and it's tied or tethered to the floor of the mouth. And you can also see on the sides of the tongue, there are little scallops or little kind of indentations and waves
Mhm.
on the tongue. So that's taking the shape of the teeth because this patient is bracing herself when she swallows, and her tongue has to come up, go on top of those teeth, and that causes a scalloped edge. And very lightly on the side of her cheek, you can also see some that linea alba or the line on the cheek. And that is when they suck the cheek in to protect too, because they don't want to bring their teeth together. So the tongue is acting like its own split, the body's splint. The body's smart enough to try to fool itself and put a splint in there without you guys having to come and see me or Priya, but that's not gonna work long term. So
Yeah.
those are the pictures that I have. There might
Love
be a
'em.
few more that for another broadcast we can gather. I'm sure I had more, but I didn't wanna bore everybody to death on all of these, but, I think that maybe we can, talk about a patient or 2, Priya,
Yeah.
or a patient that you have, or if you have a testimonial, give us the background and what the signs and what the symptoms were of that patient would be great.
Yeah, so, I do have a testimonial, and I think what I'll do is sort of tell her story first
Sure,
and then play the testimonial. Is
absolutely.
that okay? Okay.
Yep,
So her name is Kim, and she is just absolutely lovely. I asked her to get this testimonial ready for before we shot the podcast, so I literally gave her like a week and a half, and she came through, and I just adore her. And she shot it outside, and you could see the mountains in the background. She had a beanie on. She had just finished golfing. You can tell it's kind of cold, and it's
uh-huh.
just so Portland. So please enjoy when you see
Yeah,
it. Um,
yeah,
but anyway, so when Kim came to see me, her jaw was locked closed on the right side. That means that the little disc of cartilage was displaced. It was dislocated too far forward and in. Her range of motion was very limited. She had double vision and she had these bouts of vertigo that were really bad, of dizziness where she couldn't walk. She had tension in her jaw, she had tension in her head, headaches in her left eye. Uh, Her neck was hurting, popping and clicking on both sides. And her story is kind of interesting because she found me, I believe, online, but before she could get in to see me, because there was a wait, I couldn't see her right away. She actually looked on my website, and I don't know how she found this from my website, but she found that I frequently work with upper cervical chiropractors. Now, these are chiropractors who take a lot of measurements of C1, C2, C3. And they take very specific measurements and make a diagnosis. And with a series of gentle adjustments, they sort of tap C1 back into place. There's no crack, pop, or twist, no high velocity adjustments for those of you that are totally against that. These chiropractors do things very differently and they go to extra training to do that. And with NUCA, which is National Upper Cervical Chiropractic Association, they actually even have like a board certification process, which is like, I just found all this out in the past year. So she found out that I sometimes work with upper cervical chiropractors, but I don't always. And so she sort of found one on her own, which is one of the best people in the whole area. And she went to see him first before she saw me. And he, by adjusting her neck, was able to get the double vision to go away like instantly, and her pain level started going down, but her jaw was still locked. So it was pretty neat that she had some things taken care of and everything was lined up well by the time she came to see me. And then when she came to see me, I did my usual protocol. I used neuromuscular dentistry to find her exact prescription. And then I also used my knowledge of her condition to kind of tweak what the software showed me. And I think that that's
Mhm.
important. As you get experience with this, you're able to do that. And so I built her a daytime and a nighttime orthotic. She started wearing those. She unlocked within weeks. I mean, like super quick. And I think it's because her neck was taken care of first. The neck and the jaw are so intimately related that,
Yes.
the whole issue could be coming from the neck, the whole jaw issue, or vice versa. So it's really hard to know what came first, right? But the fact is that she had practitioners on her team that were communicating, they were speaking to each other, that were invested in her care. And she came through this so fast. Like, and I kept telling her, but I mean, she didn't know any different, right? But I know because I see so many people with this condition. And I really think she came through this fast because of the upper cervical care that
Oh,
she
yeah.
got. And so she's doing so much better now, really no symptoms, except sometimes every now and then she'll have a little bit of pain in her left temple. But she can open, she can chew. There's no more like vertigo that was ruining her life. She doesn't have double vision. And so she's just doing so much better and it's so exciting. And so I do have her testimonial now, which we can play.
Yeah, let's play it.
About 40 years ago, I was diagnosed with TMJ, and at that point, I couldn't afford to take care of it. And so I just kind of went with it, you know. Over the years, it would come and go. I'd have a little tenderness and chewing, and it wasn't a big deal. But then one day, everything fell apart. I started getting headaches and vertigo. Then my appointment with Dr. Priya came up, and I went in and she listened to my whole story, you know, and I showed her how far I could open my mouth. So she said, "Well, I can help you." And I said, "Let's do it." And got my night guard first and wore it. And just wearing that night guard at night relaxed my jaw so well. And it puts your whole jaw in a relaxed state. You know, they want to make sure that you're not clenched down. They want it to be relaxed. And I started feeling relief pretty quick. Then I got the day splint 2 weeks later. So then I wear that all day, and I would take it out to eat, and you know, easy peasy stuff. But you could tell that as days went by, it was getting better and better and better. And then one day I went into her and I said, "You won't believe, look how much I can open my mouth. And check this out. I mean, this is crazy, but I full wide open. We're talking, I like this, they are. You know, so many great things to say about the care that I received from them. It's just, they made it easy.
Oh my gosh, Priya, that was great. That's amazing. And when you talk about the upper cervical, I agree 100% because like you said, is it the jaw first or is it the neck first? And you gave this woman hope. You gave her life back. You know, I just love what we do. We have the best job, and it's all about the jaw and body connection, and you did an awesome job with that. And what I tell my patients too, when I'm trying to get them to see the relationship, I always say, take your finger, put it right in the nape of your neck, and just talk, and you'll see you'll feel the muscles moving. So you can't deny the connection. So you've got to go on to these other adjunct people we need you to see in order to get more better.
Yeah,
That's
and
bad grammar, but that's the truth.
it's true though, and Dr. Corey Burt is his name. We should have him on the podcast. He's the upper cervical chiropractor that I work with a
Mhm.
lot. He explained it so well. He said, "If I ask you to move your jaw, how do you do it?" And then he moved his jaw back and forth, right, left, forward, backward, whatever.
Mhm.
Now he says, now and then he says, "I want you to move your upper teeth. How do you do it?" And it's not movable. The maxilla doesn't
Right.
move. He said, "This is how you do it." And he moved his whole head.
Mhm.
And so he said the neck is in charge of moving the head. And so if
Right.
there is a true dysfunction between the maxilla, these top bones, and the mandible, we have to kind of address it from all angles. I'm addressing the position of the mandible, and he's addressing the position of the head by
Right.
working with the neck. And so I just loved that. I was like, yeah, that's a good way to explain that.
Well, and the other thing too is if you bite down normal like that, then you tilt your head forward, bite down, you bite in a different position. You tilt your head up, different teeth hit. You tilt your head to the side, different teeth hit.
Mhm,
So your neck position is so related to how your jaw comes together and how your
mhm,
teeth hit.
mhm.
It's amazing. It's
It is.
amazing.
It's so amazing.
Well, that was so great. So let me talk about my patient. So the patient that I'm talking about, and I have some photos on her too. She was a teacher. She's a special education teacher. So her name's Meredith. And when she goes to school, sometimes her little guys are combative or they throw punches, and she had terrible headaches. Every day she had some kind of head pain or migraine. Sometimes she couldn't get out of bed. She was breaking teeth. She had terrible TMJ pain, facial pain, neck pain, dizziness, vision issues, just like your lady had double vision. She had her vision would come in and out, it would go. And then she had pain in her forehead, pain in her temples, and sleep. Her sleep was awful. So I have a picture of Coop and her that's her nickname, of her fixed orthotic. So I put a fixed on her, and this is what it looked like. This is Coop, and we put her in a fixed orthotic. So you can barely see it. It's on the lower, and you can see the little blue marks from where I was checking her
Oh
occlusion.
my gosh, you can barely see that.
I know, it's beautiful. They're beautiful. And so they're not bulky, and you don't have worry about talk and all that. So we put it on the bottom, and you can see her signs, like she was wavy. You can see how her upper teeth wouldn't fit with her lower teeth, but we got her to fit, and we got her out of pain. And then there is a lower arch picture because she was a narrow arch, and I put her in braces. So on the left side was before, on the right side was after, and we expanded and moved her teeth because her teeth were also tilting in. And then there's an upper arch photo of her upper teeth, and that looks like this. And we redid the crown so it would match, but we expanded her arch, and she's like, "My tongue is so happy. It has more room." So we took her from that until the end. And then what's really interesting is her facial profile picture on what happened by remodeling some of the bone. So
Wow.
on the left is her pre-op, and on the right is her post-op. and her face just is more appealing.
It
She's
is.
a beautiful girl to begin with, but you can see more of her jawline. You can
Sure.
see her pain in her eyes is gone. And we just opened her up and made her a little broader, made a little bit more room. And then we have a testimonial that you can hear from Meredith too.
It was a hot mess. I was having migraines to the point where I was going to the ER multiple times a month. My jaw was clicking and locking to the point where it was hard to eat. My family didn't want to eat with me because it sounded horrible, and it was a lot of constant pain to the point where I was losing days of my life, laying in bed, losing time with my family, losing time at work, and something had to change. After my treatment, so much better. My quality of life is so much better. I'm able to do everything I could before I started having all the issues. And when I do get the migraines, it's easy to be able to come in and say, hey, Dr. Alex, like something's off, and she adjusts, and it's like, oh, okay, now we're all better. We sometimes look at each other now, my husband and I, like, was it worth the time, the money, the constant like appointments or juggling of our schedules? And when we look at it, we're like, it is so worth everything, because he's like, I have my wife back.
Oh my goodness. Alex, you changed her life.
I know.
I love
Yeah,
what we do. Yes.
it gets me emotional,
I know.
this
I
things
know.
do.
I know. That's
But
so sweet.
yeah, so that's awesome. So do we have a couple questions to go through?
Yes. Before we go through those questions, though, I wanted to talk to you about this case real quick. So
Sure.
with that, I know you expanded her upper arch. Now, to make the lower arch match, it's more of a tilting of the teeth, right?
Correct.
Okay.
It's a tilting of the teeth, but there is an appliance that you can put in there that will help just open up. And when you open up, the one tricky thing about ortho, because any orthodontist just can't do this, and you have a thickness of that neuromuscular orthotic, right? And like we've said before, it might be 5 millimeters thick on one side and 2 on the other. And we saw how her bite was wavy. So she was thicker on one side than the other. So you put stops on those back teeth to keep that vertical dimension, and then you start to move everything else around, get them to touch, then you take the stops off and then bring up the molar teeth.
Interesting.
So
Well,
it's interesting.
the reason I'm bringing this up is I had a orthodontist who has never practiced. He has not graduated yet. So he'll be graduating this
Mhm.
year. Really come after me on my Instagram and say, you owe it to your followers to tell the truth. And you cannot expand the lower jaw and this, and that. And I hadn't really said you could expand the lower jaw. And
Yeah, yeah, you gotta kind of watch those words. But this is what happens, Priya, and I'll be darned. Get that little green little dentist out to my office, and I'll show him a few things. But when you remodel, and that's what I call it, more remodeling, and you open up that upper arch and you bring that upper arch forward. Orthodontics is always retraction.
always.
So with what I do, it's always protraction, and it's bringing things forward. When you bring things forward and that upper jaw comes forward, here comes that lower jaw. It follows it.
That's what I told him.
It's like a friggin' magnet.
He's
It's
like,
like,
he's like,
okay, I'm
how?
coming home. Yeah,
He just
well, he's got a lot to learn,
he
but
just
that's
went
okay.
going on and on and on and on. And he's like, you clearly don't understand causality versus correlation. And I just said, practice for a while. Come back to me after
And then talk
17
to
years,
me.
after how long
Yeah,
I've been practicing.
yeah,
Unlock hundreds of jaws,
yeah.
work with actual patients, and then come back and talk to me. And he didn't like that, and he stopped talking to me. So
Oh, that's okay. You don't need to. There's so many because we do things so differently. You always get a few arrows thrown in your back, but
oh,
that's what
always.
gives you your
Yeah.
thick skin.
Yeah.
Move on.
Yeah, I have
Yeah.
pretty thick skin, but he he would just kept going. And so then I got mad and I kept going too. So that probably wasn't the most mature response, but hey, it is what it
I
is.
know, but sometimes it's that fight or flight
I
that gets
know.
in you, and you're like, I'm going to fight this one.
I know. That one I fought, and it's still there for anyone that wants to look for it. Have fun. So, but anyways, yes. So now we can answer some viewers' questions after hearing about all my drama on social media.
Okay. Okay.
Okay, so let's see. Question number 1.
How do I find someone who treats TMJ? A lot of people on their website say they treat TMJ.
Do you want to take this first or you want me to go?
Sure. It doesn't. Well, what I would say is first, if you look at the website and there is just TMJ treatment and a little blurb about it, they probably don't treat TMJ, or they'll make you a splint. So what I would do is I would call an office and I would say, I have TMJ. I would like to come there. Either how do you treat it or how many TMJ patients do you see? In my practice, I'm all TMJ patients. In Priya's practice, you're all TMJ patients. I'm cosmetic patients also, but I link that with the TMJ. I make sure their bite's right before I do my cosmetics. So I think you just have to ask and you have to look around because, again, mouth guards are just a piece of plastic. A neuromuscular mouth guard is something that is going to fit properly, make sure you function, make sure your joint is in the right position, your muscles are happy, and then the patient is happy.
Is happy.
What do you say? How do
Yeah,
you find a
I
TMJ?
agree. I mean, there's no like database that you can just easily go to because you have to have experience when you're treating this, and you
Mhm.
have to have um and I love that you and I both have offices where this is all we do.
Right.
This is our wheelhouse, and so I actually made a video for YouTube called Questions to Ask a TMJ Dentist that you're interviewing to see if that's the right fit
Mhm.
for you. And so I'll just go through the questions and add anything you'd like, Alex. Just feel free to interrupt me.
Yeah, no, go ahead.
One is how long have you been treating TMD? 2, how
Right.
do you treat TMD? 3, how do you define success in TMD treatment and what is your success rate? 4, what is your experience level and success rate in treating disc displacement without reduction, like an acute um,
Mhm.
version of that? And then 5, how many visits are included with treatment and are follow-up visits with the dentist or with the assistant? And how do you take payment and do you offer payment plans? Like, I feel like once you get all those questions answered, and I go into detail with this in the actual video, you'll have a pretty good idea if that's going to be a good fit for you or not. Because someone that's been treating this successfully and well will have good answers to those questions. Someone who has not been will not have good answers to those questions. So I know it's kind of
Right.
like putting the dentist on the spot, but don't you want to? I mean, I'm sure you're willing to do that if you're going to find the right fit.
Right. And I think too, whenever you ask the um, front desk or whoever answers the phone, the receptionist or what have you,
Mhm.
they need to say something to the fact that, oh my gosh, we treat so many TMD patients, or if they're just real lackadaisical, like, yeah, well, and they're not excited about their dentist,
Mhm.
then that might not be the office either. And then you can also go on the ICMO website, International College of Craniomandibular Orthopedics, and they have a
Mhm.
list of their members. And you can find a TMD, TMJ doc on that website,
Yeah.
right?
Yeah, I think that that's a great idea. The ICMO website is good. The only thing too, though, is when you do find someone off the ICMO.org website, ask them those same questions.
Absolutely. Don't
Yeah,
take it for granted because they
yeah.
can be a member and not have actively been treating, or they might be a member and they're a PT, because PTs are
Mhm.
a member of that website too. So you've got to kind of do your homework, and those questions are wonderful questions. I think that's great.
Yeah, I
I don't
wish it
know.
was easier, but I just Don't know of any other
It's
way.
not, but you know
Yeah.
what? That's like if you were going to a heart surgeon, you'd make sure they were good. You wanna make sure your TMJ doctor's good too, right?
Yeah.
You don't want your heart surgeon to have a high failure rate or do 1 surgery a year, because that's not the guy you wanna go to,
No,
right?
no, it's definitely not.
Right, right. So, do you have any other question in front of you?
Here's one. So I've got a question here. To see a TMJ specialist in my area, they're 4 hours away. What can I do in the meantime? So, what can they do from home to help their symptoms? So, for me, I always tell my patients to, when you're going through like an acute TMJ, TMD flare, you're in a lot of pain, baby your jaw. Don't try to over exercise it and overwork it. That's not going to work out well for you. So I would say staying away from really tough to chew foods, bagels, steak, beef jerky, raw carrots, raw apples, things that
Hard
require
pretzels.
hard
Yeah.
yeah, that require like a lot of chewing activity or are
Mhm.
like really glutinous in nature, crusty French bread, anything that causes you to makes you sort of open really wide, like a big tall sandwich. Try to just baby your jaw, stay away from those things. Try to notice if you have any habits. Like I had a patient that told me she always felt like this. And so you definitely don't want to rest your jaw against your hand because that'll shift it laterally and that's not good for the joints. Chewing on pens or other things, chewing ice or gum. Those are definitely things you want to stay away from. Self massages. I have a lot of those on my YouTube channel too. Those are sort of some things I can think of right off the bat. What about you, Dr. Alex?
I think too, moist heat. So I'll tell my patients, get a washcloth or a towel or some of those rice bags you can throw in the microwave, and then just the moist heat to help to relax the muscle. Um, I'll have my patients sometimes just bring their jaw a little bit forward
Yeah.
and just rest a little bit to kind of stretch that ligament just a little bit. I'm not
Mhm.
talking extreme,
Right.
but just to rest and try to keep your tongue to the roof of your mouth and your teeth apart and your lips sealed. So that I think helps a great deal just to try to relax. One thing you said about the hand like this, you also have to watch when you're sleeping because a lot of people will prop their hand up under their pillow and prop into their jaw and make their jaw move. Some people that feel better with ice. So those cold
Yeah.
rollers and things like that that you have, that some people are better with ice. And sometimes I say if it's really bad, you'll want to go from ice to heat to ice to heat, 20 minutes on, 20 minutes off. And that kind of confuses what's going on in the nerve synapse and that might give you some relief. But
Yes.
unfortunately, all of those things are just very limited time
Temporary.
effectiveness. And of course, you can take a muscle relaxer or you can take Advil or ibuprofen, but you got to watch the liver and things like that. But you it's just short lived. So the best thing is to get in the car for that 4-hour drive and see a TMJ
Mm.
specialist.
Yeah, that's the best thing, and for many people, it does require traveling, unfortunately, and,
Yeah,
but it can be
that it
so
does.
life-changing, so
And I think it's so worth it. Well, I think that's about it for this
yes.
podcast. I think it's been great. Keep your questions coming. We've got a lot to go through, and our next podcast, we have a special guest on, and that is Dr. Mac Lee. And
Yes.
his book is Life Throbbing Pain of TMD, Why Me? So you'll want to tune in for that. And thanks for all your support. We
Thanks,
appreciate it.
guys. Yes, we appreciate you. We'll see you next time.
Bye bye.